हेलो स्टूडेंट्स, आज हम रिकॉल करेंगे एनाटॉमी INICET 2022 मई प्लस नवंबर का पार्ट ए एंड बी। क्वेश्चन नंबर 1, विच ऑफ द फॉलोइंग मार्क्ड स्ट्रक्चर रिप्रेजेंट मीरोक्राइन ग्लैंड? इसका आंसर है बी। ए सेबेसियस होलोक्राइन, बी मीरोक्राइन, सी रूट ऑफ हेयर फॉलिकल, डी एज एडिपोज टिश्यू। क्वेश्चन नंबर 2, अरेंज द फॉलोइंग सेल्स इन बेसल टू ल्यूमिनल साइड ऑर्डर। स्पर्मेटोगोनियम, स्पर्मेटोजोआ, प्राइमरी स्पर्मेटोसाइट, स्पर्मेटिड, myofibroblast. Select the correct answer from the given below code. इसका आंसर है बी 51342, आउटसाइड टू इनसाइड, बेसल टू ल्यूमिनल। क्वेश्चन नंबर 3, मेंशन द आर्टेरियल सप्लाई ऑफ द मार्क्ड स्ट्रक्चर। ए एंटीरियर cerebral artery and middle cerebral artery, बी anterior cerebral artery and posterior cerebral artery, सी anterior cerebral artery and anterior communicating artery, डी posterior cerebral artery and middle cerebral artery। इसका आंसर है सी anterior cerebral artery and anterior communicating artery। And anterior cerebral artery and anterior communicating artery rostrum of corpus callosum has been pointed in the image given. The medial aspect get its blood supply from anterior cerebral artery and anterior communicating artery. Question number 4. Which of the following foramen is located between three bones? A. Foramen rotundum, B. Foramen lacerum, C. Foramen magnum, D. Jugular foramen. Answer है B. Foramen lacerum. The foramen lacerum is an irregular foramen located in the middle cranial fossa, posterior medial to the foramen ovale. Foramen lacerum is bounded by three bones medially by the basilar part of the occipital bone, posterior laterally by apex of petrous part of the temporal bone, anteriorly by the pterygoid process and greater wing of sphenoid. Question number 5. Which of the following structures passing through jugular foramen has a separate canal? का आंसर है ए cranial nerve number 9. Cranial nerve number 9 pierces through the endostele layer of dura mater, passes through jugular foramen as a separate canal. Question number 6. Which of the following is not a branch of the facial artery? A. Lateral nasal, B. Mental, C. Superior labial, D. Inferior labial. इसका आंसर है B. Mental. The mental artery is a terminal branch of the inferior alveolar artery arising from the maxillary artery. It often communicates with the submental and inferior labial arteries branching of the facial artery. The image is clearly showing the mental artery as a branch of the maxillary artery, so the answer is the mental artery here. Question number 7. Arrangement of the structures in anterior to posterior relations at lung hilum. A. Pulmonary vein, pulmonary artery, bronchus, bronchial artery. B. Pulmonary vein, bronchus, pulmonary artery, bronchial artery. C. Pulmonary artery, bronchial artery, bronchus, pulmonary vein. D. Bronchus, bronchial artery, pulmonary vein. इसका आंसर है ए pulmonary vein, pulmonary artery, bronchus, bronchial artery. The chief structure of composing the root of each lung are arranged in a similar manner from the front to the back on each side. This means that the upper of the two pulmonary veins are located anteriorly, the pulmonary artery is in the middle, and the bronchus and bronchial vessels are located posteriorly. Question number 8. The ligament connected medial cuneiform and second metatarsal is A. Spring ligament, B. Chopard's ligament, C. Deltoid ligament, D. Lisfranc ligament. इसका आंसर है D. Lisfranc ligament. A Lisfranc ligament connects the medial cuneiform bone to the second metatarsal and maintains proper alignment between the metatarsal bones and the tarsal bones. It acts as a shock absorber during the weight-bearing phase of the bipedal gait cycle. It also compensates the lack of an intermetatarsal ligament between the first metatarsal bone and the second metatarsal bone. Question number 9. Incorrect match about the pharyngeal arc artery derivative. First arch maxillary artery, second arch hyoid and stapedial artery, Third arch, common carotid and proximal part of ICA. Fourth arch, right subclavian artery. Sixth arch, aorta on the left side. Choose the correct answer from the below code. Its answer is C. 5. The proximal part of the sixth arch persists as the proximal part of the right pulmonary artery, while the distal section degenerates. The sixth left arch gives off the left pulmonary artery and forms the ductus arteriosus. This duct remains previous during the whole of fetal life, but then closes within the first few days after birth due to increased oxygen concentration. Oxygen concentration causes the production of bradykinin, which causes the ductus to constrict, occluding all flow. Within 1 to 3 months, the ductus is obliterated and becomes the ligamentum arteriosum. Question number 10. Which of the muscles make the pelvic diaphragm? Deep transverse, perineum, pubococcygeus, iliococcygeus, obturator internus. Choose the correct options from below code. Answer A, B and C. Levator ani muscle is a complex unit that consists of three muscle components: pubococcygeus, pubovaginalis, puboperinealis, puboanalis, puborectalis, iliococcygeus. Levator ani muscles are the most important muscle in the pelvic floor and maintain a constant state of contraction. Major function of the levator ani muscle is supporting and raising the pelvic visceral structures. It also helps in proper sexual functioning, defecation, urination, and allowing various structures to pass through it. Question number 11. A hyperkinetic involuntary movement disorder characterized by intermittent, sudden, violent, involuntary flinging or ballistic high amplitude movements of upper limb known as hemibellismus is due to which part of involvement? Putamen, B. Globus pallidus, C. Substantia nigra, D. Subthalamic nucleus. इसका आंसर है D. Subthalamic nucleus. Subthalamic nucleus hemibellismus is a hyperkinetic involuntary movement disorder characterized by intermittent, sudden, violent, involuntary flinging or ballistic high amplitude movements involving the ipsilateral arm and leg caused by dysfunction in the central nervous system of the contralateral side. Hemibellismus is usually caused by a stroke that affects a small area just below the basal ganglia called the subthalamic nucleus. The subthalamic nucleus helps control voluntary movements. Question number 12. Which are the cells present in molecular layer of cerebrum? Purkinje cells, granule cells, basket cell, stellate cell. Choose the correct answer from below code. Answer is D. 3 and 4. Molecular layer of the cerebral cortex contains stellate cell and basket cells. Question number 13. Excruciating pain along the distribution of the sciatic nerve in rectal cancer is seen in A. Anterior infiltration in males, B. Anterior infiltration in females, C. Lateral infiltration, D. Posterior infiltration. Answer is B. Anterior infiltration in females. Anterior infiltration in females sciatica in rectal cancer patients is seen due to the anterior infiltration in females. It occurs due to the perineural invasion of the inferior hypogastric plexus from which of the sciatic nerve arises. In females, the inferior hypogastric plexus lies anterolateral to the rectum, whereas in the males it lies lateral to the rectum. Question number 14. Patient with positive Trendelenburg sign. What is the action of the muscle involved? A. Flexion, B. Lateral rotation and abduction, C. Abduction and internal rotation, D. Abduction and flexion. इसका आंसर है C. Abduction and internal rotation. Abduction and internal rotation Trendelenburg sign is a test for neurological insufficiency of the gluteus medius and gluteus minimus muscles, which are innervated by the superior gluteal nerve. Major action of both gluteal medius and minimus is abduction of thigh and internal rotation. Anterior fibers, internal rotation of the thigh, posterior fibers, external rotation of the thigh when the knee is in extension. Question number 15. Skull fracture at Tyrion causes Injury to A. Most common site of fracture of skull. B. MMA is damaged in this injury. C. Fracture always occurs when patient falls sideways. D. It connects parietal, temporal, sphenoid and maxillary bones. Answer is B. MMA is damaged in this injury. MMA is damaged in this injury. Traumatic blow to the pterion may rupture the middle meningeal artery, causing an epidural hematoma. Question number 16. Which is the nerve arising from the marked place? A. Trigeminal, B. Abducens, C. Facial, D. Vestibulocochlear. Answer is B. Abducens. The nerve indicated in the image is abducens nerve, which is a motor nerve that supplies the lateral rectus muscle of the eye. It arises from the pontomedullary junction, passes through the Doral's canal, abducens nerve emerging out from pontomedullary junction. Question number 17. Name the nerve that is likely injured in the following fracture. A. Sural nerve, B. Tibial nerve, C. Common peroneal nerve, D. Femoral nerve. Answer is C. Common peroneal nerve. The structure marked is the neck of fibula. A common peroneal nerve passes around it. Common peroneal nerve. The most common presentation with common peroneal nerve injury or palsy is acute foot drop. Question number 18. Lower brachial plexus injury leads to Klumpke's paralysis. The characteristic clinical finding is A. Horner syndrome, B. Policeman's stiff hand, C. Wrist drop, D. claw hand. Answer is D. Claw hand. Claw hand Klumpke's paralysis is a neuropathy involving the lower brachial plexus. The most common etiology resulting in Klumpke's palsy is a hyperabduction trauma to the arm. The patient may persist with a claw hand. This deformity presents a finger and wrist flexion. Question number 19. Which of the following is or are derived from the marked structure? Odontoblast, sympathetic chain, melanocyte, nephrogenic, cord bulbous, cordis, conotruncal septum. Select the correct answer from the given below. Answer is C. The marked structure in the given image is neural crest cells near the neural tube. Neural crest cells contribute to many organs and tissues. Odontoblast, melanocytes, sensory ganglia, sympathetic and anterior neuron, Schwann cells, adrenal medulla cells, craniofacial skeleton, neurons for cranial ganglia, conotruncal septum of heart, C cells of the thyroid gland, smooth muscle cells, two blood vessel of face and forebrain. Question number 20. Bedridden patient aspirates lung segment involved. A. Right upper lobe apical, B. Right upper lobe posterior, C. Right lower lobe apical, D. Right lower lobe posterior. Answer is C. Right lower lobe apical. Right lower lobe apical. In supine position, the apical segment of the right lower lobe of the lung is the most dependent part. Which of the following nerves is blocked for hernia surgery? Femoral catheter. Local anesthesia is given just below the inguinal ligament for placing the femoral catheter. A. Genitofemoral nerve, B. Femoral nerve, C. Lateral cutaneous nerve of the thigh, D. Obturator nerve. Answer A. Genitofemoral nerve. Genitofemoral nerve is blocked when the local anesthesia is given just below the inguinal ligament during femoral vein catheterization. The genitofemoral nerve originates from L1 and L2 ventral rami, divides into genital and femoral branches after crossing behind the ureter. Question number 22. Which of the following is not a branch of the posterior division of the internal iliac artery or vein? A. Iliolumbar artery, B. Lateral sacral artery, C. Superior gluteal artery, D. Inferior gluteal artery. Answer is D. Inferior gluteal artery. Inferior gluteal artery, six branches of the anterior division: umbilical artery, obturator artery, inferior vesical artery in males, middle rectal artery, internal pudendal artery, and inferior gluteal artery. Posterior division of the internal iliac artery supplies parietal structure of the pelvis and gluteal region. S to L. Iliolumbar artery, lateral sacral arteries, and superior gluteal artery. Option D. Inferior gluteal artery is a branch of anterior division. Question number 23. Which statements are correct about the internal capsule? Charcot's artery supplies the posterior limb. Retrolenticular part of the internal capsule contains optic radiation. Anterior limb of the capsule contains corticospinal tract fibers of the upper limb, and face internal capsule is example of projection fibers. Select the correct answer from the given below code. Answer is C. Charcot's artery supplies the posterior limb. Retrolentiform parts contains optic radiation. Sublentiform part contains auditory radiation. Internal capsule has projection fiber statement. 3 is not correct as interior limb has frontopontine fibers. Question number 24. Which are the cells present in molecular layer of cerebellum? Purkinje cells, granule cells, basket cell, stellate cell. Select the correct answer from the given below code. Answer is D, 3 and 4. A molecular layer of the cerebral cortex contains stellate cell and basket cells. Question number 25. Muscle attached to the arrow marked bony structure is A. iliopsoas, B. gluteus maximus, C. gluteus medius, D. sartorius. Answer is A. iliopsoas. Iliopsoas marked structure in this image is the lesser trochanter of the femur. The iliacus and psoas muscle fuse to form the iliopsoas muscle, which passes anterior to the hip joint and is inserted onto the lesser trochanter of the femur. Question number 26. In the given X-ray, the arrow marked tarsal bone is A. cuneiform, B. talus, C. cuboid, D. navicular. Answer is D. Navicular.